President Trump laying out his goals for health care in his address to Congress on Tuesday night.
Tonight, I am also calling on this Congress to repeal and replace Obamacare with reforms that expand choice, increase access, lower costs, and at the same time provide better health care.
So how will this all work out, and what kind of impact will it have on you or your neighbors? Well, here for debate, Fox News Medical Aid Team's Dr. Mark Siegel, screen left, and Obamacare architect and medical ethics and healthcare chair at UPenn, Dr. Emanuel, joins us today from Philly. Doctors, good morning to you.
Great to see you, Steve.
Nice to be here.
It's great to have you. Dr. Emanuel, let's start with you. The president wants to repeal and replace. You want to repeal and repair. It's a disaster, many say. Why not just start from scratch?
Well, it's not a disaster, no matter what your metric, whether it's increasing coverage, 22 million people got covered, keeping costs down, we're at historic lows in terms of cost control, improving quality. We've actually had a decrease in infections in hospitals. We've had a decrease in readmissions. The Affordable Care Act has actually done pretty well. Does it have problems that need repair? Yes, we've all agreed to that. But that does not require radical redoing. As Secretary Price has suggested, it requires some tinkering and fixing. And that's a lot different.
All right, Dr. Emanuel. Dr. Siegel, though, says don't repair, replace, right?
Right, Steve. The issue here is that Obamacare is the type of insurance that's overfilled with regulations and too many restrictions. And I want to bring you into the doctor's office where I work every day. I'm in the medical trenches. Patients come in. When they see a big deductible, they panic. They say, I can't afford that. I'm not going for that condition. So maybe the Affordable Care Act will cover them for certain screening tests, like a mammogram, like sexually transmitted disease screening, for example. Covers women, not covering men. They go for these screenings. If they want a treatment, though, that's not covered. Then the deductible kicks in. Here's the thing. Once you meet your deductible, you can go to the doctor's office and use it for a common cold. So Dr. Emanuel says we've got to cover pre-existing conditions, and he's right. He's right. We've got to keep that. But how are we covering them? We're covering them with the kind of insurance that's expensive, with increasing premiums, and it covers you no matter what, whenever you want to use it. So a diabetic will say, well, wait a minute, I have a cold, Doc, I want to see you for the cold.
We're totally agreed that deductibles are too high. That wasn't created. That wasn't created by the Affordable Care Act. That was created by market conditions. And we should remember that before the Affordable Care Act, those preventative conditions, that mammogram, the colonoscopy, tests for men included, were not without a deductible and without a copay. So we've made advances. Have we made all the advances we wanted?
Dr. Emanuel.
No. And the Democrats have said that we would like to fix the deductible issue. That was not created by the Affordable Care Act. Most of those high deductibles,
Dr. Emanuel,
for most of your people, were created by their employers to try to keep costs down. We all agree we need to keep costs down.
I'm glad you brought up the deductibles. My daughter has Obamacare, and she can't afford to go to the doctor because her premiums are high, and she has still not met the deductible from last year. Now we're on to a new year. Here's my question, Dr. Emanuel. Hold on a second. Remember when you guys were selling the Affordable Care Act, the cost for the average family going to go down $2,500. As it turns out, it went up $2,500, $3,000. That's another reason it's a disaster. It went the wrong way.
Would you let me answer?
Yep.
There are two factors here. First of all, one of the things the Affordable Care Act did, which was never true before, is that we actually gave people primary care visits without a copay and a deductible, and so your daughter can go to the doctor without a copay and a deductible. That was never true before the Affordable Care Act.
She can't afford it because it costs so much money.
Sir, stop interrupting. The second thing I want to point out is that actually, under President Bush, premiums went up 80% in his 8 years. Under President Obama, they went up 35%, much less. Let me finish. Would you let me finish? That difference is over $4,000 for a family.
Okay.
In fact, we have saved a lot of money. It is true they went up, but
the key here is, though, introducing more choice. I want to point out,
they didn't go up as much.
I want to use the word catastrophic here, because what's being outlined now is a person can come to the doctor's office, especially a young person, and get an individualized insurance solution that works for them. In other words, maybe a health savings account. Maybe they want to buy a new car and they don't want to be overloaded with a premium, which, by the way, as you've pointed out, Zeke, the government then has to subsidize. The goal there is to cover everyone else with pre-existing conditions. I understand that, but we could decrease the amount of coverage that's mandated there. Decrease the amount of mandates, decrease the amount of regulations.
Let me ask you a question.
Go ahead.
You want to decrease the mandates. We have 10 essential benefits in the Affordable Care Act.
I've looked through them many times.
Right. Name one of them you want to throw out. You want to throw out drug coverage? You want to throw out going to the hospital? You want to throw out going to the doctor? You want to throw out ambulatory care? You want to throw out rehabilitation services? Which one are you throwing out, sir?
I already answered to begin with. I wanted to be more consistent.
Which essential benefit are you throwing out, sir?
Give me a chance to answer. I don't think we should have screening mammography and then not cover biopsies. For example, I also don't think, as Seema Verma doesn't think, that maternity coverage should be mandated for women who are never going to have children. That's a really important point that she has brought up, a woman has brought up. So I think that we have to relook at these things. Now, Tom Price said last night he wants to look through all the regulations. He wants to look through all the regulations, and figure out which help patients and which don't. And who wrote these regulations? Attorneys. Let's let a doctor look through them and see which help and which don't.
Great debate this morning. Dr. Emanuel, we thank you very much for joining. Dr. Emanuel, we're out of time. Thank you very much. I know you understand. Dr. Siegel as well, thank you.
Thank you.
Great debate.